If we act the wrong way, if we jump too soon, then you could see a resurgence of this disease. That's something we should all be really mindful of. So we get one chance to get it right. In this case, I'll call myself a conservative. I think we have to be smart about doing it in stages, making sure we can confirm that we're containing the disease more and more, getting it back to where it was, a month or two ago, before you really start to open up a lot. And look, I want to see people back to work as much as anyone. I feel it urgently. But we've got to secure the health and safety first of all New Yorkers and obviously all Americans.
And then you got to wonder what states open up first and would New York be at the bottom of that list. Let's ask Kellyanne Conway, counselor to the president. The big focus this week in the Rose Garden is getting the economy going again. How reality-based is May 1st, Kellyanne?
For some places, it certainly can be a reality if there is testing available, if your infection rates are low, your death rates are low, your hospital capacity is there, including ventilators and medical personnel, beds in the ICU. All of that is taken into account because the president has made clear from the beginning that he's not looking at a date, he's looking at data. And he will listen to the health and medical experts as well. So these are parallel tracks, and they soon will join. Now, the mayor of New York City, I agree completely that he would be incredibly cautious to look at a May 1st date or anytime soon because New York State have been among the hardest hit. About half of the deaths in the entire country, sadly, have occurred in that state. But we have 24% of our nation's counties that have had no infections. We've got about 29 states that would meet some of the criteria that I've put out first. But I think this is the fundamental point here is that the best person to revive the Donald Trump economy is Donald Trump. And with him in the lead, working with the governors, working on that health and economic guidance, and now working with so many leaders in the private sector who will come forth and share their best practices, talk about what they may want to do in their places of work. And I would say to everyone, take a look at what was put out a week ago. The CDC and the White House put out updated guidance for critical infrastructure workers. That covered about 16 different types of work, everything from our food supply to energy, waste management, sanitation, and a number of different areas that are considered to be critical infrastructure. That guidance also gives us a good look ahead because we're talking about whether you've been asymptomatic and exposed, never exposed, temperature checks should happen. Here's how the facilities and the places of work should continue to sanitize their workplaces. Everybody should continue the physical distancing, wearing a mask or a face cloth, according to the CDC's guidance of 2 weeks ago now. So there are protocols in place that will continue this new normal that we've all become accustomed to and that Americans have been practicing routinely so well to their great credit will continue in our places of work. So this won't happen in New York, I would doubt it, by a certain date anytime soon, but it will happen in other places. Opening up our places of worship, our places of work, some of our schools and places where children are also cared for seems to be one of the major keys to unlocking this economy. This will be the great American comeback. We have 17 million Americans who have filed for unemployment. 1/3 of renters did not pay their rent last month. This is tragic for this country, and it's through no fault of those individuals. We want individuals and industries to come roaring back in this Trump economy.
Yeah, Kellyanne, you mentioned the guidelines and getting back to work a lot. How will we do this? Who will help with this? Will it be guidelines that Dr. Fauci and Dr. Birx come up with, or will it be someone else?
Both of the above. They're working hard on that. So is the whole team. In the Situation Room, most days you've got the Vice President, Dr. Birx, Dr. Fauci, right like that. I sit right behind them in the second row, as do a number of White House staffers. We hear them every day. They're working collaboratively on the health outcomes, talking about the new health outcomes, for example, state by state, county by county, region by region. But now they're also talking in tandem about what it would take to open up pieces of the economy. So Dr. Birx, obviously the coronavirus coordinator here at the White House for the task force, and the head of the CDC, Dr. Redfield, along with FEMA. CDC and FEMA will have big pens, if you will, in terms of the guidance and what has to happen, and that will be issued soon. But it is exactly that, it's guidance. And then, as the president made clear in the Rose Garden last night, the governors will come forward with their own plans. Some of them are banding together for regional discussions based on, again, their needs and their interconnected I guess, market systems. But again, it took a businessman to become president to juice this economy in a fairly historic way for modern times, completing these trade deals. The unemployment rates were low. The taxes were lower, all of that, the energy dominance, the deregulation, all this created a booming economy for so many Americans. And this president helped create that economy. This president will be in the lead to resurge that economy.
Right. Kellyanne, last night the president did announce he was going to suspend payments to the WHO as he tries to figure out what exactly was going on there. China clearly was deceptive at the early stages of the pandemic, and the WHO repeated a lot of that to the world as if it was exactly accurate. Now, there's a story, I'm looking at foxnews.com. The State Department has leaked cables that renew theories on the origin of the coronavirus. Apparently, 2 years ago, the State Department was concerned about what was going on in a particular lab in Wuhan. What can you tell us about that?
Sure. Well, that's all out in the public domain, everything that you just said. First, let me take it, the WHO funding. This is a president who recognizes that our country, ladies and gentlemen, you the taxpayers, have paid $830-some million over the last 2 years to the WHO. China paid 10% of that. China, France, Italy, and India combined paid about 1/10 of what the United States of America has paid into the World Health Organization. It's meant to coordinate responses and keep an eye on things, particularly in the case of infectious diseases, for the entire world. So we pay into that. And is it so much to ask? The minor dividend, the minor return on our investment would be for the WHO to be honest about the origins of the virus in Wuhan, about the fact that it was human-to-human transmission. They lied about that or weren't transparent about that. So this is about transparency and accountability, because we've been so hard hit in this country, and we were listening to the health professionals around the world. I sat in some of those early meetings, and we were getting Americans, we were repatriating them from Wuhan and from other parts in China. The president took decisive and immediate action the end of January to shut down flights from China. That was criticized by the WHO. It was criticized by other people as xenophobic and racist, and travel bans don't work. Well, this one sure did. So we have every right to know, and every right to know because of what's happened here in this global pandemic. But there's another reason. Some of the scientists and doctors say that there could be other strains later on. This can come back in the fall in a limited way. This is COVID-19, not COVID-1, folks. And so you would think the people charged with the World Health Organization facts and figures would be on top of that. That this is just a pause right now. So there's an investigation, examination to what happened. But people should know the facts. We paid over $830 million over the last 2 years. China paid 10% of that.
Right, and we all should know the facts that China fundamentally lied, and we still don't have the truth, and the WHO didn't stop it, but China is the problem. Meanwhile, the president's trying to get this economy rebooted again, and he's calling on some experts from all different aspects of our economy to pitch in, one of which we hear is Mark Cuban, who's been a constant guest on our show and our network, just saying he wants to help out. He's got over 100 businesses, as well as he's got that sports thing going with the NBA. What could you tell us about this?
Well, there are many people involved, and there are people who will be involved who aren't on the list who will participate in calls and give advice as well. The list is illustrative. I doubt it's exhaustive, because there are so many talented men and women across this country who want to bring to bear their successes, their best practices, and their places of work, and figure out how they, too, can be part of the great American comeback. The president, a couple weeks ago, had a fabulous call with the heads of all the sports leagues. We know emotionally and economically, restarting some of our sports, live sports action, would go a long way to showing America that it's coming back. But we've got small businesses, we've got captains of industry, really runs the gamut of the private sector to actually combine with all these public sector efforts. The Congress is passing trillions of dollars in relief. The president is working 24/7.
Gotcha.
The public sector, FEMA and all, have been tremendous. And let me go back to one thing you said about China. I think this is important. Dr. Redfield said last week. Oh, I'm sorry, that we had, on February 28th, we had 14 cases in this country. 14. We had 2 human-to-human transmissions, and they were spouses. One in California, one in Illinois. This just catapulted. And do you know
Right.
the WHO did not call this a global pandemic until March? I had referred to it as a pandemic on your show as a layperson before they had referred to it. So the foot dragging is also a concern. The president wants to tap into private
Gotcha.
industry, public sector, and get this economy roaring for many Americans.
Right. Thanks, Kellyanne. Appreciate it.
Thank you. Take care.